friends, I'm going to present a very rare case today, which I saw last week, that is aorto right atrial fistula. I'll keep on presenting as and when I see new cases and rare ones, and I think it's a good idea to subscribe so that the moment I put a new case, you would be notified immediately. If I tell you about the brief history of the patient, this is about 47 years old male, which has a history of a mild dyspnea class 2 for last about 10 years. But 3 years back he had a prolonged fever. This was on a repeated poking and asking from the patient. He did comment that he had a fever 3 years back, which lasted for about 2 or 3 weeks and got all right with prolonged antibiotic use. But he says that the dyspnea has increased ever since then. And echo was done actually twice or thrice in a tertiary care unit, and the diagnosis was given tricuspid valve endocarditis and a thickening of the tricuspid valve. But this case doesn't have a thickening of the tricuspid valve. I'm going to show you. And of late he is having some mild swelling of the feet suggestive of a congestive heart failure. Now look at this picture. Now this video, let's see what is the glaring feature. The glaring feature are two. One is the enlarged right atrium, and then is this thickened mass kind of thing in place where the tricuspid valve is. There is a mild pericardial effusion all around. Now this was the diagnosis made because based on this, that this is the tricuspid valve which is thickened and possibly has vegetations like structure here at the tip. But if you notice carefully, the tricuspid valve is here. That's what made me suspect that this is not a tricuspid valve. This is the tricuspid valve, the septal leaflet, that's the anterior leaflet, you see it here. But if you angulate the probes little higher and you rotate it, this is what you see, proving our point that this is the anterior leaflet of the tricuspid valve, this is the septal leaflet of tricuspid valve, and you see a tunnel-like structure coming here, right, originating from aorta. This is a tunnel which is originating from aorta and opening into the right atrium with some shaggy margins in the right atrium. And color Doppler proved our point, showing that there is a continuous flow. The pisa you see lies in the aorta, indicating this is the orifice of the tunnel, and then it opens right into the right atrium. And notice there is a non-cooptation of the tricuspid valves. They are not meeting each other in systole, and this actually is leading to a severe tricuspid regurgitation, or a free flow tricuspid regurgitation as we call it. What probably had happened, that there is a right fistula in the right atrium from the aorta, leading to a large volume of blood coming to the right atrium, causing the dilatation of the right atrium, and then causing a dilatation of tricuspid annular ring, producing a non-cooptation here and a severe TR, and severe TR further led to further increase in right atrial size. So this is the three-dimensional echo which was done from the RV side, and the cut shows that you have this as a tricuspid leaflet. This is the septal leaflet, anterior leaflet, and the posterior leaflet, and you see some structure coming here from the right atrium into the tricuspid orifice. And if I may show you by stopping this video, this is what is an aorto right atrial fistula. This is in systole when the tricuspid valve is open, and you can see in the right atrium behind, this is the fistula which is protruding here. Secondly, you see this non-coopting valve. This is during systole, and you notice there is a hole left even during systole, causing a non-cooptation. So what happened in this patient? He was symptomatic for last about 10 years, probably because of congenital aortoatrial fistula. He had a left to right shunt causing right atrial volume overload. In between, he had infective endocarditis, and this all led to right atrial dilatation, tricuspid annular dilatation leading to non-coaptation of the tricuspid valve, and severe TR, which is a vicious cycle, further increasing the right atrial size. This led to heart failure features and atrial fibrillation in this patient. What have we suggested? We've suggested now that to repair and close of the fistula from the aorta to the right atrium, but at this stage he would require a tricuspid annular repair as well because of the free flow tricuspid regurgitation. On reviewing the literature, there is one review article which you've seen and which has kind of digged out all the cases of AV fistula, aorto atrial fistulas or tunnels they call it. Then the commonest cause they found was ascending aorta to the right atrium, though there were multiple other sites where fistulas can happen. From ascending aorta, it can open into the right atrium, it can open into the right ventricle, it can open into the left atrium, it can open into the coronary sinus, and from the descending aorta, it can open either into the right atrium or a left atrium. So these are various types of aortoatrial fistulas, but the commonest what we showed you was ascending aorta to right atrial fistula. It commonly comes from a non-coronary sinus of Valsalva, but in our case it was from the right coronary sinus of Valsalva. So thank you very much for watching this interesting case. I think again reminding that subscribe the channel so that the moment I put a case study, you would be immediately notified. Happy learning. Thank you very much.